North Dakota Governor Doug Burgum issued executive orders today that will allow healthcare workers who have tested positive for COVID but are asymptomatic, do not have symptoms, to remain on the job and work with COVID patients. Burgum says it took 7 months for North Dakota to get to 5,000 cases of COVID. Now, in less than a month, the state is over 10,000 cases, and hospitals have been pushed to capacity with all the other usual reasons for being hospitalized. So hospitals are having a hard time keeping enough staff on hand.
So today we took a step to help address the staffing issue with an amended state health officer order that now is going to allow asymptomatic COVID-positive healthcare workers to work in COVID units of licensed healthcare facilities so long as they remain asymptomatic, and additional precautions are taken as recommended by the CDC and the North Dakota Department of Health to protect both the worker and the patients in that unit. This is something that the CDC has allowed for a period of time. North Dakota's health orders were actually more restrictive than the CDC, so we're moving those to come in line with the CDC, which again will free up some of those asymptomatic healthcare workers are going to be able to go back to work in COVID units. And again, this applies only to COVID-positive healthcare workers who do not have symptoms, and they are allowed only to work in COVID units around patients who already have the virus. So that's one step that we're doing. We also know that there is an opportunity because when a healthcare worker is tested and their test gets sent away, it could be 24 to 48 hours before they get a response to find out if they're positive or negative. Meanwhile, while they're in that waiting period, they're effectively on the sideline. And we know that some of those do come back positive. The majority come back negative. The person can then go back to work because they're negative. If we could have given them that result in 15 minutes instead of 2 days, that frees up, in some cases for some hospital, dozens of people that are sort of perpetually, it rotates who they are, but as people get exposed, they get tested, they wait for the results. We've got a portion of healthcare workers that are on the sidelines waiting for test results. So working with the state health department in our unified command, we're going to begin shifting rapid testing towards healthcare workers.
The idea being to keep healthcare workers on the job and not quarantined. I'm Neil Carlson reporting for iNewZ.TV.